Okay. Now, you spoke a little bit about the unmet needs of this patient group. Can you kind of expand on that? What are some of the gaps in our knowledge of this disease, and maybe some of the gaps in treatment of this disease?
Yeah, so I think really the most important point is that there really, up until now, many antipsychotics have been developed that are then in some respects used in a life cycle management way to go and look at, can it work in another disease state, depression in bipolar. The bipolar patient, really the unmet need there is in the state of these persistent depressive episodes, right? That's when they withdraw, that's when they have very low drive, that's when they don't interact with their family. They have very significant mood swings as well. And so what we've been able to do is now really engineer the pharmacology around treating those depressive episodes. And at the same time, we've been able to go and also include a low amount of dopamine D2 block, but very low, so that we don't have the adverse events of the dopamine system. And it also allows us to treat and engineer an efficacy where we weren't going to actually acquire any of the treatment emergent mania that one would be concerned about in the disease state by treating a bipolar person with a serotonin-based drug.
Okay. Now, the last couple months have been, psych patients have been really, I guess, under the microscope as far as how everyone's dealing with shelter in place and now the stress of kind of opening back up and what's been going on. Have we learned anything about bipolar depression patients in general, and how do you feel this patient population handled this recent time period?
So thank you for the question. I guess the most important thing to say is that Synovian is committed to work on major psychiatric and neurological disorders, whether it's every day or whether there's a global pandemic. And so we have been committed, as we spoke earlier this year, to develop new drugs for schizophrenic patients, in this case focused on bipolar depressed patients. What I think we've been able to see is that these global pandemics, that stress and that uncertainty really has an effect on the entire population. It is exacerbated in those patients, but the programs that we work on are really to treat the most serious of ill patients across the spectrum of psychiatric disorders.
And I guess, what is the next step for SCP-4199?
Thank you for the question. So the next step for SCP-4199 is to actually go and talk to regulators. We'll be having conversations with regulatory authorities, both in Japan as well as Europe and the United States. Those meetings will happen over the remainder of this year. We are very confident in the proof of concept which has been attained with the initial study, and we hope to initiate phase 3 studies in the near future.